Cindy Tatsumi to you all and thank her for being here. And please go ahead, Cindy.
Okay, thank you, Pat. Well, good morning, everybody. And it's so nice to see you all. And thank you for Zooming in. I've been on Zoom pretty many times, but not to host so much. So bear with me if I have any hesitations here with the changing of screens. I'm currently retired from professional nursing of 40 plus years, which has included the last 20 years, mostly in nursing education. I have taught at College of the Desert. I want to thank Alzheimer's Coachella Valley for inviting me to speak today. I see some familiar faces out there. I'm going to talk today about prevention of falls in the elderly by giving a brief overview of the brain, define concussion, identify the cycle of falling, suggest safety precautions for your home and beyond, provide tips on discussion with your doctor, and finally discuss how medication, nutrition, and vision can affect your ability to safely navigate a daily routine. Now, there have been some links provided to you already by Priscilla. There should have been one for exercises, and we'll talk about this at the very end, to promote strength and mobility, and another link for home safety strategies, which I'm going to cover today in the PowerPoint presentation, but it'll be just a good reminder. And I also sent out a list of local and national injury prevention resources. And so I hope you were able to click on those and get those. If you did not get them in an email, please check with Priscilla. Thank you all for taking the pre-test survey, and I appreciate your post-presentation comments also. This helps us evaluate our program and the people that we reach. I want to take a few minutes before we start into the falls in the elderly program. I want to talk a few minutes about ThinkFirst. I've been involved with ThinkFirst for 20 plus years, first in Colorado as an educator and coordinator, and just recently I received additional training to establish a chapter in the Coachella Valley. ThinkFirst is a national brain and spinal cord injury prevention foundation and was co-founded in 1976 by two American neurosurgeons, Dr. E. Fletcher Eister and Dr. Clark Watts. These doctors were frustrated by the high amount of brain and spinal cord injuries they saw in the emergency room. They could not cure. So they responded with injury prevention and developed programs in their own communities for the middle and high school students to raise awareness about the consequences of risk-taking behavior. Several years later, the American Association and Congress of Neurological Surgeons asked them to develop a nationwide program. ThinkFirst became a nonprofit 501c3 charitable organization in 1990 with chapters all over the world. ThinkFirst's mission is to reduce injuries through education, research, and advocacy. There are 6 different programs, including ThinkFirst for Teens, ThinkFirst for Youth, grades 4 through 5, ThinkFirst for Kids, grades 1 through 3, curriculum-based, and concussion education, and several of the newer programs are ThinkFirst for Babies and Preventing Falls in the Elderly. Their slogan is to use your mind to protect your body. So I'm going to do a PowerPoint presentation, and we'll take comments and questions at the end, but I decided to do a brief video about concussion because we're going to talk a little bit about concussion. And this is a less than 5-minute video provided by ThinkFirst, and it's a young woman that has had a concussion related to a gymnastics injury. Now you might say, well, how does that relate to me? But the thing is that an injury to the brain or head, it's really not age related. and a concussion or a brain injury can affect anybody. So I hope you can get some sense of what a concussion is before we start talking about it. So Priscilla, I'm going to ask you now, then do I just go to share screen? Okay, I'm going to try that. Bear with me. Okay, now I'm going to see if it's up there. And if not, Priscilla, I might have to ask you to share the one that you have. So let's see.
Okay.
I don't see it on my screen to share. I don't see it up there. Is
Okay.
it? Yeah.
Okay, bear with me 1 minute then.
Sure. And I'm not sure how I should click out then.
Okay, I'm just.
Oh, now wait, I may see it. I see it.
Okay.
Here we go. Okay, let's try it.
Looks good.
Okay, here it comes.
If it asks you to share the computer sound, make sure you click on that.
My first concussion happened when I was actually 12 years old. I was doing a beam routine and my dismount was a round off dismount and I backstuck off the beam and I just missed my foot on the round off. And so I slipped and hit my head on the side of the beam and that actually, same thing.
I just don't see the picture. Oh, here we go.
It's coming through. It's just delayed because of internet speed. So
It hit me till about 2 weeks later when my mom went to wake me up and I wasn't waking up. And then she took me to the doctor and they said I had a concussion. Okay, so when I got the biggest concussion, I was 14 years old in 8th grade, and I was doing a simple drill on the floor that I've done over and over again. And for whatever reason, I just kind of stopped in midair. I was doing a back step, and my head and neck went one way on the floor, my body went the other. So I ended up fracturing the C7 in my back neck area. And then the concussion itself put me out for a long time, and the doctors didn't think I was going to be able to do gymnastics again. I was feeling terrible for a very long time, and he would make me take memory tests once a month to test my memory, and until I could pass them, then I wasn't able to do gymnastics. Well, I never passed them. So I was forced to quit, and I would experience migraines and everything. To this day, I still experience migraines. So with the C7 fracture in my neck, I just had to wear a neck brace for I think 2 months, and then it healed, and they did therapy on it. And even today, I still go back and get therapy on it every now and then because it gets a little tight or it gets a little stiff, that sort of thing. When I first went on a year break from gymnastics, I was really depressed. I think it's very important that you take the time off that the doctor is requesting you to take off just so that you fully heal properly. Sometimes you have to make sacrifices in order to stay healthy. So you can't even get into college if you don't have the right grades. So if your brain's not functioning correctly to make the grades, then the scholarship for your sport isn't going to do any good. So I think take it easy with your injuries when they occur. There's just very many ways to get involved with the sport that you love, even if you're not capable to participate. I did that for a long time, so I just kind of hung around the gym for a while, stayed in touch with my friends that were on the team, because the friends that were on the team, we had all been on the same team since we were 8 years old when we all started competitive gymnastics, and all of a sudden I was sort of ripped away from my friends. So even to this day, some of us still keep in touch. I'm studying sport administration, and I'm actually in my 4th year now. So throughout the years of college, I've actually learned a lot of different techniques. I use a lot of note cards. I study extra probably more than anybody else. It takes me a little bit longer. When I used to take math classes, I had 3 tutors just to get through math. And I guess from the concussions, numbers, and my brain don't function properly. So a lot of tutors, a lot of note cards. So at first I was resistant to go on the IEP because I didn't want to be made fun of or anything like that. But then once I was on it, it was just like an extra class a day, basically. And they allowed me, like I said, to use note cards. They worked with me a lot for different studying techniques to use in order to be able to pass my tests and pass school. So it was great. I think an IEP is nothing that you need to be afraid of. I think it's something that if you're having problems with your memory or any other headache problems or anything like that, I think it's something that you should definitely be able to look into. You know when something's hurting, when something's not right. So it's just very important that all athletes have the awareness enough of their own body to make sure that they can say, like, I'm hurting, I can't do this anymore, because some athletes are very afraid to do that. I think that's the most important part of being involved in a sport, is being able to communicate with coaches. I would definitely tell parents, listen to your child. Whether the child is saying, I want to go back to the sport, you have to actually look at your child, know your child. I would definitely tell young people to listen to the doctors. At the time, I didn't like it, and I would get very upset. So you have one brain, and you don't want to ruin it by furthering an injury. You want to take care of it so that you're able to get into college, make the grades. You only get one chance with that one brain, so you don't want to do anything that's going to hurt it further.
I think that's probably about it there.
So then Cindy, just go to the top of the screen. I think you'll click on stop share.
Okay, there we go.
There you go. Perfect. Nice job.
Perfect. Yeah, and we can catch up more if any questions about that video. But I think knowing that this young woman had a concussion, as we start to talk about it, and if perhaps any of you have fallen and also had a concussion, you can kind of relate. Well, here's a young woman, she had this same difficulty, so, and is challenged by this. So I hope that helps. So now, Priscilla, just hit slide share and go on to the PowerPoint. Okay, thanks for
Yes.
your help. Okay, so this, okay, slide share, here we go. All right. And I don't think I'm on the first, okay, thank you. I'm not on, here we go. And I think I have to do slideshow, play from the start. Here we go.
Try that, yeah.
Here we go. Okay.
Nice, very good.
Okay, perfect. Okay, so I'm going to start out with the purpose of today's program is to explain the significance of falls and brain injury in older adults. So let's consider more than 1/3 of people 65 and older fall each year. 2/3 of those who fall will do so again within 6 months. And falls are the leading cause of both fatal and non-fatal injuries for those 65 and over. In 2015, medical costs for falls totaled more than $50 billion. Medicare and Medicaid shouldered 75% of those costs. Priscilla, I'm just checking. Can you hear me okay? Okay, thank you. As you can see in this pie chart, 40.5% of all cases of traumatic brain injury are from falls. It's really quite remarkable. Brain injuries by unknown or other is 19%, and struck by or against 15.5%, which would be that young lady that struck her head on that gymnastics beam, and then followed by motor vehicle accidents at 14.3%, and then assaults at 10.7% by attack or trauma. So we start all of our programs with a brief overview of the brain to remind us how important it is to protect it. Now this slide shows the brain and its different lobes, and the brain is divided into 2 hemispheres, right and left. Of course, this diagram only shows the one side. The frontal lobe is responsible for problem solving, organizing, planning, behavior and emotions, and social skills. And the parietal lobe near the center of the brain on top controls motor and sensory information, hot and cold, recognizes awareness in different parts of the body, and a tolerance for noise. The temporal lobe on the sides is responsible for memory, hearing, word retrieval, recognizing familiar faces, attention span, and concentration. The occipital lobe in the back part of the brain is where visual information is processed. And the cerebellum, or small brain, is located in the back of the brain below the occipital lobe and it controls movement, balance, and coordination, muscle tone, and your walking. Now the brain stem, it's identified at the bottom there in the red, is composed of the medulla and the pons, and this connects the brain to the spinal cord, and it's responsible for all of the vital functions of respiration, heart rate, blood pressure, and swallowing. Now let's talk about the word concussion and what it means. We just saw the video of the young girl that said she was having memory problems, migraine headaches, and she could no longer function at the high level that she once did as a gymnast. So a concussion is considered a type of traumatic brain injury. We abbreviate it as TBI. It's a disruption to the normal functioning of the brain, not the structure of the brain. Your head does not have to be hit to cause a concussion, nor does one need to lose consciousness. In fact, only 10% of concussions result in the loss of consciousness. And because it is a disruption of how the brain works, brain CAT scans or CT scans and MRI results are normal with most concussions. Now, the following are symptoms. This means something that you experience on a concussion or a traumatic brain injury. You may experience a headache or head pressure, nausea or vomiting, blurred vision, dizziness, sensitivity to light or sound, feeling groggy or sluggish, and you just don't feel right. If this happens, tell someone you know. If you know or someone you know suspect a concussion or have even just one of these symptoms, tell someone, tell your doctor and get evaluated. Don't hide it. If you are not admitted to the hospital, you will still need to follow your doctor's instructions for rest while the brain heals, which may include avoiding activities that are physically demanding or require a lot of concentration. This can worsen symptoms and slow recovery. Avoid sustained computer use, TV, noise, and bright lights until you've been cleared to return to normal activities, and get plenty of rest. Now, here are some of the common causes or risk factors for falls in the elderly. Vision impairments or low vision diseases, which means it can't be corrected by eyeglasses. Unsafe home environments, which we'll talk about in a few minutes. Multiple medication regimens, and loss of physical fitness. Now, on those handouts that I had Priscilla email to you, there's local and national resources, and there is the American Foundation for Blindness at afb.org. And you can look on there. There's many, many resources, and we'll talk more about that for magnifiers and things like that. Now, as a result of these risk factors that we just talked about, lack of physical fitness, multiple medications, things like that, a fear of falling can develop. This can lead to a decline in functional fitness as evidenced by problems with walking, balance, flexibility, and endurance. This can lead further to a reduction in your ability to move well and a loss of independence. This potential isolation may negatively impact your mental health and quality of life. In the event that you do feel yourself falling, try to protect yourself in the fall with the following tips. The most important body part you need to protect is your head. Tuck your chin and lower your head. Turn as you fall and keep your arms and legs loose and bent. If you're falling either straight forward or backwards, try to turn your body so you land on your side to protect yourself from a head injury. Landing fully on your arms to catch yourself can break both arms and wrists. So try to send the energy into a roll if possible. This will help reduce the absorption of the impact on your body. Now, there is another national resource that's on your paper that's a handout, and it's actually how to fall safely. So you can have these resources and go back and check at that and pick up some tips. Try not to panic. Don't try to get up too quickly or in an awkward position. You may make your injury worse. Remember to take several deep breaths and assess the situation to determine if you're hurt. If you feel strong enough to get up, follow these steps. If you can crawl to a strong, stable furniture like a chair and pull yourself up, approach the chair from the front. This is, you crawl over to a chair and approach it from the front and put both hands on the seat. Slowly begin to rise. Now bend whichever knee is stronger. Keep your other knee on the floor and slowly twist around and sit in the chair. I know it happens to many people. Someone's fallen and you might go over and help somebody else try to get up off the floor. I think this technique of trying to crawl over and to rise onto the chair may be helpful. You see a lot of different techniques, but I think this would be helpful. Now, what if you can't get up? If you believe you're injured, do not attempt to get up. Take some of these steps to ensure your safety until help arrives. First, use your phone. Hopefully it's in your pocket. And we're going to talk more about this, to keep your phone with you all the time. Or press your pendant or safety bracelet alarm like a life alert for help to family, friend, or 911. Always have emergency contact numbers programmed into your phone. And if those options are not available, try to attract attention by shouting or banging on something. Next, try to get comfortable until help arrives. Find a nearby pillow or rolled up item of clothing to place under your head. Try to keep warm by finding something to cover yourself with, such as a piece of clothing or blanket. As you are waiting, it's important that you try to keep moving if you're able. Wiggle your toes, move your hands, shift positions if possible. Roll away from any damp, wet areas. After help arrives following a fall, always notify your doctor regardless of injury. Now that you've learned about causes and consequences or potential outcomes of falls, let's move on to prevention. Now, general safety in the home. You also got a handout on this, so this is a repeat for some of you. So keep your phone with you at all times. As I mentioned earlier, program your emergency contact numbers into the phone. I personally wear a small fanny pack at home for my phone. If I don't have a pair of jeans or pants that have a pocket, I always just keep my phone in a fanny pack. So I always have it. Or have an emergency response system, pendant or bracelet, for example, life alert on yourself. Declutter any rooms or pathways and be aware of tripping hazards, such as pets, young children, extension cords, and throw rugs. I personally fell last year. It was over a Foley catheter of a patient's. My foot got in there and tripped me, and I fell really hard. So I can liken that to an extension cord or something in your own home. Have to be very careful of cords, and have sufficient lighting in your home. Now in the kitchen, slow down and don't try to do too many things at once. Remember to keep often used items within easy reach and be mindful of the stove and oven at all times when in use. Beware of loose, bulky clothing as a fire or tripping hazard, and keep a small fire extinguisher on hand. I know it's easy to turn the stove on and have something cooking on the burner, and then, oh, I'm going to run out and get the newspaper on the driveway and then come back in or something like that. You try to stay focused. When you have the burner on, you got to stay with it. Having ovens and stoves with knobs on the front of appliances are safer and most easy to reach versus knobs in the back and reaching over hot burners. If using a step stool for higher to reach items, make sure the stool has a handle on it and rubber feet on the bottom. Do not climb on a chair to reach items. Do not carry filled pots of water, slide them on your counter. And remember to use sturdy, non-slip mat in front of the sink. Now, in the bathroom, planning ahead for safety is essential. The tub and floor can be slick. Have non-slip mats or treads in the shower and tub. Use a secure bath mat outside the tub and shower. And secure mounted grab bars next to the toilet and within, the shower and bath. In the shower, use a handheld sprayer and seat bench. Use a raised seat height for toilet. It's more forgiving for the knees and making it less likely to tip over. Use lever-handled faucets to turn on and off for easily controlled water temperature. And to prevent slipping, try water shoes with mesh top and rubber bottom to enter and exit and stand in the tub and shower. Let's think about safety in the bedroom. If you're more at risk for falls, try to be on the side of the bed closest to the bathroom. Take your time getting out of the bed and to the bathroom and make sure that you can see where you're going at all times. Use adequate lighting and include a night light that automatically turns on when natural light dims. Excuse me. Pause when getting up and sit on the edge of the bed for a minute before standing up. In nursing, we call this dangling, sitting at the side of the bed just to get your circulation balanced. Wear closed back shoes or slippers and have smoke and carbon monoxide detectors installed near the entrance of the bedroom, and have a phone again by your bedside. Now on the stairs and hallways, plan ahead for hazards. Excuse me, I just have to drink a bit of water, I'm sorry. I got dry. Avoid carrying large loads up and down the stairs that may block your vision. Always make sure you can see the floor in front of you. I had a dear friend that was carrying a load in his arms, and he didn't see the curb, and he stepped down and ended up breaking his hip. So you always want to have a clear view of what's in front of you. Focus to make sure that you finish each step going up and down the stairs. Have handrails on both sides of the stairs. Use an over-shoulder bag to carry items hands-free, and have a phone in your pocket in case of emergency. Again, you can have that fanny pack. Wear shoes on the stairs, not stocking feet. Use tread strips on stairs with reflective color or contrast. And in the hallway, excuse me, use a small cart if transporting a load to maintain safer balance. I had another patient that the patient, her husband, they had a very long hallway, and he would have a grocery cart inside their home, and when he brought groceries in from the car, he would load things in there, and then he would just push that cart. They had a one-level home all the way into the kitchen, so he didn't have to worry about carrying bags. Let's move on to shopping and walking. Now let's talk about safety outside the home, as you might be carrying items in or out shopping.
Gosh.
Excuse me? Scan ahead for slick spots or ramps. Am I too loud, or is, I'm okay? Okay, can't tell. Use crosswalks whenever possible. Give yourself additional time to cross the street. How many times have you been driving and you see somebody trying to scurry across the street? Really, so use the crosswalks. Be safe and be seen, and stay away from parked cars. Again, I had another friend that had a very severe head injury in a parking lot. A car backed into him, didn't see him. There was a blind spot, and it was a young man, and became head injury. Use a grocery cart to and from the store for stability in carrying a small load. Parking near the grocery carts can allow easy access to the cart. Use a wide base of support, and I'm starting to find I'm doing this myself. If you have knee problems or anything like that and you feel a little wobbly, your feet should be shoulder width apart when stepping up and down from the curb. Use reflective wear and light colored clothing. This is a must if you're out after dark. And carry a flashlight if walking at night. Now, if you're outside doing yard work, here's a few tips. If using an inside or outside ramp, it should have a slope no greater than 1 inch of height for every 12 inches of length, or that's a 4.8 degree angle. And have handrails on both sides. Again, use non-skid deck paint or adhesive strips on this ramp or steps. And when you're doing your gardening, use a garden kneeler or stool for easier up-down when gardening. And use a trekking pole or cane for stability. Wear sturdy shoes, and again, have your over-the-shoulder bag for your garden supplies to keep your hands free. This is a disclaimer just to say that any information in this presentation is not intended to diagnose health problems or take the place of medical advice or care you receive from your physician. Always consult your provider about your medications, symptoms, and health concerns. Now let's take the next few minutes to discuss talking with your doctor. Whether you have physical or emotional needs, any concerns or lifestyle changes may be stressful and are important to your well-being. Make a list of everything to share with your doctor, including your prescribed and over-the-counter medications, vitamins, and herbal remedies, if any. Keep a list of the doctors who prescribe each medication and the amount you take. If you have concerns about falling, these tips may help you voice your concerns. It can be helpful for your doctor if you have the following information on hand. Knowing how many times you have fallen in a specific time period, when was the last time you fell, and what was the cause? For example, was it dizziness, tripping, anxiety? Was it something unavoidable? This will let the doctor know how prevalent the problem is and how to move forward. It's important to note and keep record of any changes you have made because of your experience with falls. This awareness includes anything that it has prevented you from doing and if you have a fear of falling. Let's look at medications on this slide and how they may be related to falls. You may look at these and think, okay, I take one of those, I take one of those. Taking just one of these medications can put you at a higher risk for falling. Medications for thinning the blood, depression, anxiety, pain, swelling or congestion in the ankles or lungs, high blood pressure, and constipation. These medications can all cause a drop in blood pressure, produce sedation, and increase fluid loss, placing you at higher risk of becoming dizzy upon standing, sitting, or turning. Many Americans 65 years or older take on an average of 4 different daily medications. The more medications a person takes, the higher risk they are for falling. Older adults have decreased kidney function, and this can cause medications to stay in the body longer, causing stronger side effects. So organize yourself at home and take medications safely. Talk to your doctor or pharmacist if you have questions about how to take the medication or any written information that comes along with the medication. Be sure to check the label before taking any medications to ensure you're taking the right one and it has your name on it. Take the medication at the time instructed. If you take a medication in the morning that was prescribed to be taken at night, it could make you drowsy and cause you to fall or worse. Do not stop taking a medication unless your doctor says it's okay, even if you start to feel better. Call your doctor immediately if you're having side effects. He or she may prescribe a different medication or offer suggestions on how to decrease side effects. Now, also there's a few more resources on that page of the link that Priscilla sent you. The National Institute on Aging has safe use of medicines, and the National Institute of Public Health. So look over your resources later. Now I'm going to move on the next two slides for vision. I'm going to give a brief overview of vision loss and safety because these eye diseases can cause a risk for fall. These are conditions that are diagnosed and managed by your doctor. 4 of the most common eye diseases are age-related macular degeneration. This is a progressive condition of blurred or loss of central vision resulting from scarring or hemorrhage of abnormal growth of blood vessels under the macula, which is a part of the retina, which is the camera of your eye. It is the leading cause of vision loss in people age 50 or over. Causes could be inflammation, exposure to ultraviolet light, and smoking. The second one is cataract. It's a condition characterized by clouding of the natural lens of the eye, causing hazy vision and or double vision with potential to impair the ability to read or drive. Per your physician, condition may be treated safely and effectively with surgery. The third one is glaucoma. It's characterized by a fluid buildup in the front part of the eye, resulting in intraocular pressure and potential damage to the optic nerve. And per your doctor's order may include treatment with eye drops, oral medications, or potential surgery. And the fourth one is diabetic retinopathy. This is damage to the blood vessels due to diabetes type 1 and 2. Symptoms may include floaters and potential vision loss. Treatment may include, per your doctor's orders, continued management of the diabetes, monitoring, possible medications, and or surgery. Again, there's sources on your link that I sent you, and the second one is the National Eye Institute. So please check those out. Now here are ways that you can help yourself with your eye conditions. It's important to remember to schedule routine eye exams with your provider at a minimum of once a year to identify and prevent any progression of disease. Common eye diseases progress slowly and can only be identified by dilating the eyes and measuring eye pressure. So you'll want to have somebody drive you home from the exam. As we already discussed, make modifications in your home to prevent falls related to visual disturbances. Remove throw rugs, install ramps, declutter rooms, and be aware of tripping hazards. Use proper lighting and visual aids. A complete list of handheld magnifiers or electric magnifiers can be found at the website on your resource page that Priscilla has sent you, and this is the American Foundation for the Blind. Locally, we have the Braille Institute, and I understand that they've recently moved. I have not visited that new location yet. Use contrasting colors in your home and to help with depth perception and visual imbalances. We're almost done. A few tips on healthy eating and staying hydrated. Staying hydrated with proper nutrition can help how we think and feel and encourage a sense of well-being. Everyone has different caloric, fluid, and nutritional needs, so check with your doctor. As we age, we lose our sense of thirst, so think about drinking water, juice, milk, and soups. Keeping hydrated ensures you have enough fluid flowing throughout your body. The adult body is about 60% of water. Dehydration can cause lightheadedness and fainting. Here's some healthy choices. There's also 2 websites. Perhaps most of you are familiar with choosemyplate.gov and the National Institute of Health, again, on healthy eating after 50. And important things is choosing healthy foods, keeping a healthy weight, lose or maintain a healthy weight. This helps reduce the risk of developing chronic diseases such as high blood pressure, diabetes, hypertension, and heart disease. So I'm going to click out of this stop share and come out of that. Can all kind of relax and take a deep breath. Thank you for your attention on that. So before I finish, I want to mention the exercise handout that you received as a link. These are provided by ThinkFirst. And also, though, before you start any exercise program, check with your physician first to see if these are right for you. And if you experience any pain or difficulty with these exercises, stop and consult with your provider before continuing. Many of these exercises are done seated, while others are in a standing position using a chair for support. Routine exercises help both physical and mental well-being while helping with balance, strength, endurance, flexibility, and also blood pressure regulation. So let's finish with just a summarize with a few strategies on fall prevention. So use the 10-second rule. Okay, well, what's that? Pause and count when changing positions, such as lying in bed to standing, especially if you're on those medications that can cause a shift in fluid change. Sit at the side of the bed first and take some deep breaths. This will give your body enough time to balance out and allow blood to flow to your brain. Second, steady yourself when standing. Make sure to hold on to something. Remember to rise slowly. And 3, be sure to stay hydrated. And 4, finally add some type of exercise to your day, even if it's just dorsiflexing your ankles and getting blood to flow into your calves, moving your hands, rotating your wrist, something, shrugging your shoulders, something, just get your blood flowing. So in conclusion, I want to thank you for your attention. Please know that falls are not a natural part of aging. And please know that there are many things that you can do and can consider to do to help prevent a fall from occurring, whether it's changes in your home, lifestyle changes, or just talking to your doctor. It could make a big difference in staying independent. I hope you learned at least one thing today to help prevent falls in your future. Thank you again.